Vessel damages as the common pathway of mortality diseases. Number 1358, September 17, 2025. Gerald C. EclaireMD Foundation. Category: Vessel damages. Preface. During 16 years of intensive medical research, supported by more than 4 million data points from my own body, one clear picture has emerged: the majority of mortality diseases are simply different outcomes of blood vessel damage, caused by metabolic disorders and poor lifestyle habits. Yet when I searched through thousands of medical papers, I found very few that present this unified framework. Instead, medicine remains divided into fragmented specialties and scattered statistics. This article offers an integrated perspective: how macro and microvascular injuries, accumulated silently over decades, represent the hidden common pathway behind diabetes complications, cardiovascular disease, chronic kidney disease, strokes, dementia, and even certain aspects of cancer. Fragmentation of modern medicine. Modern medicine is structured into specialties. Cardiology studies coronary arteries, neurology focuses on cerebral vessels, nephrology investigates renal microcirculation, and endocrinology centers on glucose regulation. Each specialty produces thousands of research papers every year, but each remains confined to its own markers and endpoints. As a result, medical journals rarely state the obvious. A narrowed coronary artery and a calcified brain, arteriole, are two expressions of the same vascular injury process. The same four drivers, obesity, hyperglycemia, hypertension, and dyslipidemia, damage every vessel in the body, macro or micro, differing only by size, location, and timing of failure. This artificial separation obscures the bigger picture and prevents a systems-based understanding of disease progression. The role of biomarkers and statistics. Most clinical research is designed around biomarkers, such as hemoglobin A1c, HDL and LDL cholesterol, or systolic blood pressure. While convenient for measurement, these are poor substitutes for systemic disease progression, because they capture only one variable at one point in time. For example, a randomized trial may show that lowering hemoglobin A1c from 7.5% to 6.5% reduces microvascular complications. But the true story is that years of uncontrolled glucose stiffen arteries, scar endothelial linings, and fuel chronic inflammation. Statistics based on short-term averages and narrow markers cannot capture cumulative, nonlinear, dynamic, and irreversible vascular damage over decades. As a result, research papers often describe one slice of the disease process, without connecting it to the broader trajectory of vascular deterioration. Lifestyle is the root cause. The majority of vascular injury is not driven by genetics or chance, but by daily lifestyle behaviors. Overeating carbohydrates, sugars, fat, and salt overloads the metabolic system. Inactivity reduces blood circulation and accelerates arterial stiffness. Insufficient sleep undermines vascular repair. Stress produces sympathetic surges that rupture fragile vessels. Yet lifestyle medicine remains underfunded, because it does not yield blockbuster drugs, devices, or procedures. Current research publications emphasize downstream interventions: stents, dialysis, bypass surgeries, and pharmaceuticals. Journals highlight rescue, not prevention, leaving the root causes underexplored. Cumulative and irreversible damage. Vessel injury is not a one-time event. It is a continuous process, most of which is irreversible. Each day of hyperglycemia leaves microscopic footprints of glycation and oxidative stress. Each year of elevated blood pressure stiffens arterial walls further. Over decades, vessel calcification makes these injuries permanent. When patients finally undergo CT or MRI scans, the bright white calcifications represent scars of decades of metabolic and lifestyle neglect. At that stage, treatment is late, expensive, and often ineffective. The current medical research model is not well equipped to study decades-long nonlinear and nonlinear dynamic deterioration. This explains why so few papers describe mortality diseases explicitly as cumulative. Vascular failures, despite clear evidence. Cancer and the edge cases. Some argue that cancer is not part of this vessel damage paradigm. Yet cancer also depends on circulation. Tumors grow by hijacking angiogenesis, stealing nutrients and oxygen, and evading immune surveillance. All processes mediated through blood vessels. Lifestyle factors such as obesity, poor diet, alcohol, inactivity, insufficient sleep, and chronic stress are well-documented cancer risks, even where the causal chain is more complex. Vascular health remains a decisive factor in cancer development and progression. A unified model. From my research, the logic can be summarized simply. Inputs: metabolic disorders and poor lifestyle, high glucose, high blood pressure, dyslipidemia, obesity, poor sleep, and high stress. Process: daily vascular stress causes endothelial dysfunction, vessel stiffness, leakage, and calcification. Outputs: depending on which vessels fail, and the degree of damage, outcomes differ. coronary arteries, myocardial infarction, cerebral small vessels, stroke or dementia, renal microcirculation, kidney failure, peripheral vessels, neuropathy, retinopathy, or ulcers. The same process produces different endpoints, depending on location and severity. Why the literature is silent. The absence of this unified framing is not because it is untrue, but because of systemic limitations. Specialty silos divide the discussion and obscure the macro view. Short-term studies cannot model cumulative damage across decades. Funding bias favors commercially viable drugs and devices over lifestyle prevention, since preventive measures offer limited potential for profit maximization. Statistical tools emphasize averages and narrow endpoints, while ignoring outliers and overlooking dynamic, nonlinear, and irreversible processes. Personal evidence. My own health journey across past 35 years illustrates this paradigm. For 2 decades I neglected my conditions of obesity, type 2 diabetes, hypertension, dyslipidemia, and poor lifestyle. The results were predictable: 5 cardiovascular events, kidney disease, neuropathy, retinopathy, fatty liver, and eventually a hemorrhagic stroke. Each of these outcomes was simply a different manifestation of cumulative vascular injury. Since 2010, however, I have applied strict lifestyle management and the viscoplastic medicine theory's energy model, VMT. Gradually, I observed reversal trends: weight loss, lower glucose, improved sleep, and reduced stress, all of which relieved vascular stress at both macro and micro levels. This personal longitudinal data, combined with theoretical modeling based on mathematics and physics, confirms that daily lifestyle choices, not isolated genetic predispositions, are the dominant force behind vascular damage and mortality disease outcomes. Engineering analogy. In my earlier career, I worked in engineering. For example, when designing a bridge, I would calculate the static load, for example the weight of a heavy truck, and compare it with the bridge's elastic capacity, or its ability to return to its original state after the load was removed. A well-designed bridge can carry traffic for years without visible problems, but daily traffic leaves microscopic wear and tear within the materials. These tiny cracks are invisible but accumulate over decades. Then, when a powerful hurricane strikes, the bridge collapses. The storm appears to be the cause, but the true reason is the decades of hidden damage that weakened the structure long before. The same principle applies in medicine. Our organs and vessels handle daily stresses, glucose spikes, blood pressure surges, emotional stress. In the short term, the body appears to recover, just as a bridge flexes back after each truck. But over years, repeated stresses leave footprints: arterial stiffening, vessel calcification, and scarring. Eventually, one acute event, a pressure surge, a clot, or an infection, acts as the hurricane that tips the system into failure. The resulting heart attack, stroke, kidney failure, or dementia may seem sudden, but in reality, the root cause is decades of cumulative micro damage. Conclusion: if mortality diseases are viewed separately, the truth is missed. They are not isolated entities, but one family of outcomes, most of them rooted in vascular injury. The true enemy is not diabetes, hypertension, kidney disease, or dementia individually. The real enemy is the daily injury, inflicted on our blood vessels by poor lifestyle and metabolic disorders. Addressing this requires accurate knowledge, strong willpower, and persistence in changing habits, early and sustaining them for life. Until medical research embraces this unified framework, patients will continue to receive fragmented care, treatments will remain reactive, and preventable suffering and premature death will persist. Disclaimer: this content is for educational reference only and not medical advice. No doctor-patient relationship is created. You may share this article freely, but it must not be edited or republished as your own.